So one of the things that I'd really like to do to move this field forward is to provide better support, particularly for women, because I feel that that is one of their biggest issues. So we are now embarking on a new research study that will actually do that. And the reason we've decided to focus on this area is our previous research, which looked at young adults who survived a heart attack, made it very clear to us that there were several issues that need to be addressed. Those issues are the following. When you have a heart attack, the median length of stay in hospital, so the average, if you will, amount of time you spend in hospital, is actually only 2 days. So think of it, you've just had a frightening, life-altering event, and 2 days later, you're sent home. The healthcare system and the healthcare providers do their absolute best to try and help you understand what has happened to you, to talk to you about how your lifestyle needs to change so that you reduce your risk of another heart attack and make a better recovery. But our study made it very clear that that time frame is too short for them to understand what has happened to them, let alone understand everything that they heard about stop smoking, start exercising, change your diet, go to cardiac rehab. Here are 4 or 5 drugs that we want you to take. That's a lot for people to absorb. So we would like to conduct a research study that looks at a concept that's been used in cancer that's called a nurse navigator. This is an individual that helps the patient transition from the acute care setting, so the hospital that they went to when they had their heart attack, and going back into the community. So this individual becomes a bridge. This person reminds them about all these changes they need to make. This person reminds them about their medications. This person asks them whether they've signed up for cardiac rehab or not, and if they haven't, how can I help you do that? Have you gone to see your family physician? Because remember, you were told to see your family physician within a week of going home. So that type of support is something that we think is critically important, and I personally think would impact women much more, because it really speaks to that supportive role that is so important in the recovery.